Hi, I'm Gene Liu and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles. And I'm here today to give you immediate post-op instructions about a tonsillectomy or tonsil and adenoidectomy. So you just had your tonsils and possibly the adenoids taken out. It's going to be a rough week or two. In general, young children get through the entire recovery process in 2 weeks. Older children and adults may take 3 weeks. First and foremost is staying on top of the pain. You're going to march out Tylenol and Motrin around the clock usually for the first few days. You might be taking a little bit of morphine or narcotic in addition to that. As a general rule, it's a lot better to stay ahead of the pain than let it get out of control and then try to play catch up. Because of the grogginess of narcotics, if you're taking any, you probably shouldn't be working, you shouldn't be driving or operating heavy machinery. Usually the pain can be managed somewhat reasonably, but you're still going to be uncomfortable. It is impossible to get rid of the pain completely, so don't expect no pain. What you need is enough management of the pain where you can drink and keep liquids down to stay hydrated. If you're starting to get darker and darker urine and only go into the bathroom a couple of times a day, then that's a sign of trouble. You're going to have to reinforce oral hydration or drinking a lot more, and if that doesn't work, you may need to go to an urgent care or an emergency room for IV fluids. Having a temperature that creeps up to 101 or even higher sometimes after tonsil or adenoid surgery is completely normal. As long as it comes back down with Tylenol and Motrin, we're not going to worry. Keep in mind though that if your temperature is creeping up, it's even more important to hydrate. It's only if the temperature stays above 102, even though you're taking Tylenol and Motrin, that it's time to call the doctor. During the 2-week recovery period, what doctors worry most about is the risk of bleeding. So if you start coughing or spitting up any red blood, call the office. Immediately, if you gargle on some ice water or suck on some ice chips or popsicles, it may help cut down or even stop the bleeding. Blood that has been dripping down into your stomach may cause a lot of nausea and discomfort, and if you cough or vomit it up, it may look like coffee grounds. Because the risk of bleeding is there for 2 weeks, we generally don't want people doing anything too physically active. No trampolines, no jungle gyms, no lifting weights. We also don't want people going on airplanes or on cruise ships or going camping in the middle of nowhere. That way, if you're the unlucky few percent that do have some bleeding afterwards, you're still going to be somewhat near healthcare. If you look in the back of the throat, initially things are going to be swollen. The uvula, the little punching bag in the middle, may be very puffy. And in the areas where the tonsils used to be, it's going to look white, yellow, gray, or brown with ugly scabs. Don't worry about it, that's the way it always looks. Also, you're frequently going to have a very bad breath. Don't try to get rid of it by brushing your teeth or using mouthwashes. It's going to really sting the back of the throat. Just kind of leave it alone and it'll go away when it's completely healed. Something else that we notice is neck stiffness. The area behind the nose and throat gets stretched when you're moving your neck around. So in the recovery period, there can be a tendency to not want to move the neck. That goes away once the healing is done. Most children miss school for 1 week, but are able to go back with light physical activity and no PE during that second week. Most adults are going to be able to go back to work at about the 1 week mark as well, as long as their job isn't construction or involving a lot of physical labor. I hope this information was helpful. If you have any other questions, feel free to reach out to the office.